is Dr. Dan Cooper. I'm the Director of Chiropractic Medicine here at the Performance Lab Tampa. My professional career has been primarily in sports chiropractic, and then I had a long stint, actually about 8 years, in professional teaching. I was a professor at a chiropractic college. Within that, there was some concierge medicine in there as well. So I did some on-site care with people in home. Everything from musculoskeletal stuff through functional medicine, even into some emotional things people had that I had to deal with. You know, my military time, so I did 8 years in the Army. I was in the infantry. I was stationed in DC, and so if you think about that time frame, I was a first responder to the Pentagon for 9/11. I did ceremonies for foreign dignitaries, presidents, heads of states. They'd come and visit the country. We'd do ceremonies to say hello. And we were doing riot training for the International Monetary Fund. Had a convention, they had some credible threats, and so we were doing this riot training for that. And we had our sergeant major of the unit came down and said, hey, a plane hit the trade centers. Don't know what's going on, but we actually hear the plane hit the Pentagon. Because it's only maybe a half mile bird's eye view from where we were training. It's a big grow up time for pretty much everybody in the unit. I actually finished undergrad, and then I was deployed out of a reserve unit to Baghdad. So I come back from that. I had already been accepted to chiropractic college at that point. Used it well. Like I rehabbed myself from my injuries in Iraq. That's where I got into functional medicine. Early on in chiropractic college, I had learned about functional medicine. If you're not familiar with it, it is a branch of the healing arts where you use Western testing. So it's blood work, stool samples, hair samples, just depends on what you're looking for. And you look at patterns within those results. So it's not straight deficiency equals you give them this kind of thing. It's more, how is the system functioning? And I get in an ATV accident in chiro school. I am destroyed. I had a bunch of brain bleeds. I had so much orthopedic damage. I can understand what patients feel because I'm in doctor school, you know, and I'm going to come out and be a practitioner. And if I've never experienced what it's like to actually be knocked down and have these significant life problems that need to be addressed appropriately, I'm missing a piece of that patient empathy and understanding of what they're going through. A patient who doesn't understand what's going on with them or doesn't understand the path forward will have fear associated with that. You know, there's fear associated with the unknown. And when there is fear, there's often catastrophizing just in their own ideation of what's going on with them that always results in worse outcomes. So if you want a most positive outcome and a most positive long-term outcome, the patient needs to understand what's happening with them, understand that what the best route forward is, because one thing, they'll lose some fear out of that, which takes that catastrophizing piece out of the equation, but also it adds agency to their life. A doctor-patient relationship is a relationship. It is not a doctor controlling the patient. And there is a responsibility of the patient in any kind of recovery. And so if the patient understands and they understand the path forward, they can participate in their rehab. And that's super important. The intervertebral disc, if you can picture the spinal column, you have these blocks of bone on top of each other and they got to move, right? So you have this disc in between. It's got a tough fibrous outer layer, a jelly inner layer so that it can move and spin and roll. Herniations is a good example. You have any damage to the disc, you can have where that jelly inner part kind of breaks through that tough outer layer. It can cause pain. It can cause a ton of inflammation in the spinal canal because that nucleus, that jelly part, is actually inflammatory when it comes out of that tough outer layer. And you'll see all kinds of symptoms with it. The way that discs create health and fluidity in the disc, as we sit in our lives, sedentary lifestyles, they promote disc damage through, it's called desiccation, where the fluid is pressed out of that jelly inner layer. The disc height goes down, it gets stiffer, and that annulus on the outside, the tough outer layer, it doesn't shrink up. So you get some slide in there, it starts to tug on the end plates of the disc, you get bone spurs, so all kinds of different bony problems and spine problems can happen with sedentary lifestyles. This can also happen with traumatic events too. The process by which the disc pulls fluid into the center is called imbibition. It's this because you don't have vascularity into the center of the disc. So how does it pull moisture in to be healthy? It does it by alternations of compression and distraction. So if I bend, I compress one side and distract the other. So as I move around and be active in my life, I'm pumping that disc, pulling moisture out of the end plates into that middle part of the disc, keeping it nice and healthy and plump and able to move around. Decompression does that mechanically. So now you have this machine pulling the vertebrae apart, relaxing them back together. Pulling them apart, relaxing them back together. So it's pulling moisture into that disc, which increases the height of that disc. And it's because your spinal nerves come out of the spine, through kind of like a little taco that makes a hole, and when the disc gets short, it pinches that hole. So as the disc gets plumper, it can make more space, reducing some of those symptoms that are associated with disc problems. So we have a whole spine full of linked segments that go together. The extremities are involved too, because chiropractic, you can adjust any joint in the body as long as it's restricted in its motion, and that's the goal. You're looking for restrictions, isolated restrictions within the system, and your goal is to free those up. So as somebody's moving, you're talking about performance, as somebody's moving through a performance program or performance rehab, if they have restrictions in any single segment or a couple segments, now you're having altered motion based on that restriction. So it's very difficult to get appropriate motor patterns ingrained and then trained if there's kinks in the system. And so the idea with adjusting is to free up those segments so they have the ability to move fully through the full natural range of motion, so they can produce good motor patterning during the training. From it's just a personal note of what it feels like to help people when they're in pain. One of the things that happens with people is they'll stop doing things they like. And so when you stop doing things you like, because either you're afraid, when you look at elderly populations, they're afraid of falling. That's a really common complaint with elderly populations. So they're afraid of falling, they don't go out anymore. So giving people some of their enjoyment back, that like zest for life because they now can, I think that's the most fun thing to see in someone's face when they've recovered from whatever it is they're coming in for. My name is Dr. Dan Cooper. Welcome to the Performance Lab.